The Committee on Education and the Workforce will come to order. A quorum being present, the committee meets today to consider the committee print on legislation regarding the committee's instructions pursuant to Section 2002A1 of S.Con.Res 11 and to report the legislation to the House Budget Committee under the Budget Agreement. Given time constraints, I would ask that members insert any written statements into the record. I will hold the record open until the end of the day in order to accommodate those members who may not have prepared written statements. I now recognize myself for an opening statement for today's committee consideration of committee print on legislation regarding the committee's instructions pursuant to Section 2002 of S.Con.Res 11. Okay, good morning. Today the committee meets to report a proposal to the House Budget Committee under a joint budget resolution the House and Senate agreed to earlier this year. As part of that resolution, the committee has been tasked with finding savings from programs within our jurisdiction, and the recommendation outlined in the committee print will do just that. Since the Republican majority began nearly 5 years ago, Speaker Boehner has urged every one of us to make the people's priorities our priorities. That is what this committee has always tried to do, and today's effort is no different. In fact, the reconciliation process presents an opportunity to address three urgent priorities. The first priority is getting our nation's fiscal house in order. As members of the House Education and the Workforce Committee, we know this is a particularly important responsibility. Reckless federal spending is a threat to students and working families, and the threat has grown exponentially worse in recent years. Under President Obama's watch, the national debt has increased by nearly 71% and currently stands at more than $18 trillion. We're on a fiscal path that is not sustainable and have been for far too long. That is why, under Republican leadership, Congress passed a balanced budget that would lead to less debt, stronger economy, and more prosperity for the American people. As the Speaker has noted, we are on track to cut $2.1 trillion in government spending over the next 10 years. We're also making progress improving federal policies and programs so that each one delivers positive results for students, workers, and taxpayers. But we still have a lot of work to do. The reconciliation process reflects our commitment to using the tools we have to reform government and rein in deficit spending. The second priority is dismantling Obamacare. Under the President's health care law, costs are going up, not down. We continue to hear reports and stories of families facing higher premiums or higher deductibles or both. Patients are losing access to their trusted doctors as insurance carriers squeeze provider networks to control costs. Meanwhile, workers and employers are struggling because of the law's punitive rules and mandates. The proposal before us would repeal a particular mandate known as auto-enrollment. As the name suggests, the law requires certain employers to automatically enroll employees in a government-approved insurance plan. This mandate will create a lot of unnecessary confusion for workers and employers and result in costly penalties for those who may already have insurance coverage. The mandate is so convoluted and confusing that after 4 years, the Department of Labor still hasn't figured out a way to enforce it. Let's repeal this costly mandate and help empower workers to do what's best for themselves and their families. The third and final priority we can and must address through reconciliation is holding Planned Parenthood accountable. Recent videos portray a number of practices by Planned Parenthood that are nothing short of gruesome and shocking. Charmaine Yost, president of Americans United for Life, recently testified the videos as, quote, deeply unsettling as well as, quote, tragic and difficult to watch. She went on to say, quote, Americans should not be forced to fund such unethical and abhorrent practices. Many in Congress and concerned citizens from across the country agree. Our colleagues on the Energy and Commerce Committee are leading this important effort. Right now, they are considering a reconciliation proposal that would stop the flow of taxpayer dollars to Planned Parenthood and redirect those resources to higher quality health care services for women. I hope we seize this opportunity to protect taxpayers and hold this organization accountable. In closing, let me just say that the reconciliation process is never easy. It is always tough, complicated, and controversial. But because of our work here today, as well as the efforts of our colleagues on the Energy and Commerce Committee and the Ways and Means Committee, we can take an important step that will address the priorities of the American people. I urge my colleagues to support this proposal and the reconciliation process as it unfolds in the weeks ahead. With that, I now recognize the ranking member, Mr. Scott, for his opening remarks.
Thank you, Mr. Chairman. And today the committee will consider and inevitably report a bill that represents only a small portion of a larger reconciliation package. We need to therefore be completely clear about what this committee is in fact considering today. This committee will take another vote to determine whether or not we want to continue on the path where the sole aim is systematic destruction of the Affordable Care Act. More specifically, we will vote on whether or not we want to support a budget reconciliation process that seeks to take away health insurance from millions of Americans. This is not a new exercise. The majority in Congress has been at this for 5 years, trying to chip away at the Affordable Care Act and undermine the progress we've made in providing coverage for all American families. We've seen 60 repeal votes, multiple lawsuits, and countless attacks, all with the same goal of turning the clock backwards on the progress we've made. This time it's through the budget reconciliation process, but the idea is not new. In 2010, when Congress passed and President Obama signed the Affordable Care Act, we did so to change the trajectory that we were on and to improve a system that had left millions of Americans out in the cold, left millions without any consumer protection in health coverage, and classified being a woman as a pre-existing condition, enabling insurance companies to charge them more than men. If you lost your job, you usually lost your insurance and your health care coverage, and if you had a pre-existing condition, you were just out of luck. If you wanted to start a new business, but you and your family relied on your employer-provided coverage, then too bad, you're stuck at your job. If you're a senior that hit the Part D prescriptive drug donut hole, then you had no help in affording your medications. In many areas, I believe we've made great progress in improving on a system that didn't work for many American families. For example, the passage of the Affordable Care Act has given millions of Americans access to health insurance coverage, many for the first time in their lives. The ACA is closing the donut hole for seniors, improving coverage options for young people. It has encouraged and improved access to mental health services and preventive care. Further, it's helped slow the growth in health care costs, resulting in the lowest annual increase in health care spending since the governor began tracking the statistic in 1960. New research conducted by Kaiser found that the average premium for employer-based coverage is growing more slowly than in recent years. Mr. Chairman, I ask unanimous consent to enter into the record a New York Times article from July 16, 2013, that showed that premiums for New Yorkers were set to fall 50% as a direct result of the Affordable Care Act.
Without objection.
Mr. Chairman, I've said in this committee before, the budgeting requires making tough choices, and a budget that is in fact a reflection of, priorities. As legislators, we decide what our priorities are and how to best invest in our country. Since the bill we are considering today is being presented to us for inclusion in the budget reconciliation package, I want to make sure that one major priority is clear on this side, and that is that protecting access to health care insurance for all Americans is one of those high priorities. If this package saves any money at all, it's because fewer Americans will be covered, and that's a step in the wrong direction. Thank you, Mr. Chairman, and I yield back the balance of my time.
Gentleman yields back. Thank you. The committee will now proceed to the consideration of the committee print for amendment. Without objection, the committee print will be considered as read and open for amendment at any point, and any amendment offered shall be considered as read. I will soon recognize Ms. Stefanik to offer an amendment in the nature of a substitute. Without objection, the amendment shall be considered original text and open to amendment at any point. The amendment in the nature of a substitute has already been distributed and is in each of your folders. I now recognize Ms. Stefanik for 5 minutes to explain the substitute.
Thank you, Chairman Klein, and thank you for convening today's markup. For more than 5 years, the President's health care law has failed to produce the kind of health care system the American people deserve. While the Obama administration continues to tout its government takeover of health care, hardworking men and women across the country have been forced to contend with less access to doctors, a system plagued by waste and abuse, costly penalties, canceled plans, and even higher health care costs. Those workers and families were promised that costs would go down. They've gone up. They were promised jobs would be created. They've been destroyed. They were promised that if they liked their health care plan, they would be able to keep it. And that promise was broken. It's only becoming clearer that the American people were handed a bunch of empty promises about the benefits of Obamacare. What they're seeing instead are consequences, and those consequences are playing out in communities across this country. This reality is unacceptable, and it's particularly unacceptable at a time when our economy is still struggling to recover, a time when so many people are still looking for jobs, and a time when small business owners are being forced to contend with a barrage of executive orders and regulations that make keeping their doors open a constant struggle. This is why it's so important to make common sense fixes to this law where possible. My constituents in New York's 21st District want us to work together in Congress to ease the pain this law is having on so many North Country families and businesses. The measure we're here to discuss today is a step forward, both in our efforts to protect workers and job creators from the President's government-run healthcare system, and in our efforts to rein in our out-of-control debts and deficits. It accomplishes these goals by getting rid of a duplicative and onerous Obamacare mandate known as auto-enrollment, in moving employer-sponsored health care coverage away from a voluntary and flexible model. The President's health care law has created a myriad of penalties and mandates. This particular provision requires certain employers to automatically enroll their full-time employees in health care coverage. What this means is that if a veteran or a student in my district who is eligible for TRICARE or to stay on their parents' health care plan gets a job, they will be automatically enrolled in an unnecessary health care plan unless they know about this provision and decline coverage within a prescribed amount of time. This auto-enrollment mandate will create unnecessary confusion for my constituents, and by triggering tax penalties could actually cost employees who might already be enrolled in health insurance coverage. The mandate will also limit an employee's ability to select a healthcare policy that works best for his or her family. It's redundant, it's unnecessary, and it's not in line with the patient-centered healthcare system this country needs. The measure under consideration today would eliminate that misguided mandate, but does nothing to take away an employee's ability to opt in and enroll in his or her employer's coverage. The proposed substitute amendment simply makes technical drafting corrections to the underlying proposal. I urge my colleagues to support the substitute as well as the underlying measure, and I yield back the balance of my time.
Gentlelady yields back. Thank you very much. Are there members?
Mr. Chairman.
Ms. Fudge.
Mr. Chairman, I move to strike the last word.
You're recognized for 5 minutes.
Thank you very much, Mr. Chairman. And thanks to the Affordable Care Act, millions of Americans have gained access to quality, affordable health care coverage. The Affordable Care Act is working. It is time we acknowledge that fact and get back to good governance. At the beginning of 2015, more than 587,000 Ohioans were enrolled in Medicaid, expansion, or CHIP. In February 2015, an additional 230,000 Ohioans selected or automatically re-enrolled in the ACA through the federal marketplace. As of March 2015, more than 10 million Americans had access to coverage in the marketplace. The number of uninsured has decreased by 17.6 million people. This number could be even further reduced if this body spent more time working to expand coverage to those who we've not reached. I represent some of the country's premier hospitals and healthcare networks. However, even in Ohio, we still have plenty of work to do to ensure our world-class healthcare reaches all of our citizens. Rather than wasting time on what will probably become the 61st vote to repeal the Affordable Care Act, this committee and this Congress should be focused on how best to strengthen the law, how best to extend health care coverage to every single American. This country prides itself on having the best health care in the world. Yet the United States recently ranked 61st globally in maternal health, performing worse than any other developed country. We have listened over and over for the last few weeks as women's access to health care has been attacked time and time again. Women in the United States faced a 1 in 1,800 risk of maternal death. This is the highest risk of any developed country. In 2014, the overall U.S. healthcare system ranked worst among industrialized nations for the 5th time and we are still the most expensive system in the world. The health disparities among our nation's ethnic and racial groups is a disgrace. In 2010, African Americans were 30% more likely to die from heart disease as compared to non-Hispanic whites. Hispanic mothers were twice as likely to receive late or no care at all compared to non-Hispanic white mothers. African Americans have 2.2 times the infant mortality rate as non-Hispanic whites. Your race and your socioeconomic status should not determine your ability to access life-saving or even basic health care. These are the issues we should be discussing. This is where we should be focusing our attention. We should be expanding coverage, not taking it away, with no semblance of a replacement plan on the horizon. I oppose this effort and use the budget reconciliation process to once again attack the President's health care plan and the millions of hardworking Americans who rely on it. Mr. Chairman, I yield back.
Gentlelady yields back. Other members seeking recognition. Ms. Adams, you're recognized.
Thank you, Mr. Chair. I move to strike the last word. Mr. Chairman, before us, we have a real opportunity for deficit reduction, but instead, the majority has decided to use this as another attempt to take health care away from the American people. Across the country, the Affordable Care Act has provided 17.6 million uninsured Americans with health insurance, significantly reducing the rate of uninsured Americans. The Affordable Care Act is working. It's helping millions of Americans get the care that they need. And although my Republican governor in North Carolina chose not to expand Medicaid coverage for more than 350,000 people under ACA, it's working there too. Today, more than 407,000 North Carolinians now have access to care. People need and want access to affordable and quality health care. I remember in 1966, a convention of the Medical Committee for Human Rights, Dr. Martin Luther King said, of all of the forms of inequality, injustice in health care is the most shocking and inhumane. Growing up, my family could not afford health insurance, and I won't forget the emergency room visits to get care for my sister who suffered from sickle cell anemia. And although the disease took her life at 26, I can't imagine what life would be like for her if we had health insurance. Now, does it mean that the Affordable Care Act is perfect? No, it's not. But we shouldn't be working to repeal it. Instead, we should be protecting and strengthening it. One of the best things about the Affordable Care Act is the preventive care it provides. 78 million Americans have access to preventive care through ACA. And if you're getting the right preventive care, your doctors can detect things earlier, and that can either encourage you to change your lifestyle or it will force you to change it. So it's important for this care to remain available for people to utilize it. And I can say the same about Planned Parenthood, another provider of safe and affordable reproductive health care for millions of American women and men. But let's be honest, this is not about attacking Planned Parenthood. It's a part of a grander scheme. Attacking Planned Parenthood is just the start of an extreme agenda to roll back women's rights. Planned Parenthood is a valuable resource for many women, especially in low-income communities. And last year in my home state of North Carolina, Planned Parenthood served more than 31,000 patients and nationally more than 2.7 million women. Many chastise Planned Parenthood for their abortion services, but that's just a small fraction of the work that they do. Only 3% of its services are abortion-related. And more than 90% of Planned Parenthood services is preventive care. Breast exams, cancer screenings, and contraceptive services, not to mention STI testing and treatment and family support services. So why would we want to deny women who are often low income these very necessary benefits? And as I listen to my constituents, Mr. Chair, explain the struggles that they endure within the American health care system, it's become clear to me that although we have one of the best health care systems in the world, there's a lot more that we need to do. Providing access to quality and affordable health care is a step in the right direction. Thank you, Mr. Chair. I yield back.
Gentlelady yields back. Other members seeking, Mr. Polis, you're recognized for 5 minutes.
I move to strike the last word. Thank you, Chairman Klein, for the time, and Ranking Member Scott for presiding over this markup. I appreciate the time. but I do find this exercise to be somewhat redundant. As many of you know, this is the 61st time that we are rehashing whether or not to repeal the Affordable Care Act. Folding this debate into the budget reconciliation process is simply another tactic to repeal the Affordable Care Act. I find that an irresponsible path for this committee and Congress to take when the quality, affordable health care of millions of Americans is at stake, and when there are so many serious questions about our budget and our deficits that we're leaving unaddressed, instead using this political process for the 61st time. We're spending our time attacking rather than improving a law that is working for 27 million people who have or will gain health insurance through the marketplace for the first time, as well as millions of others who've been able to enroll in Medicaid for the first time. I know in my home state of Colorado, the Affordable Care Act has made a huge impact on the lives and livelihoods of many of my constituents. Colorado's uninsured rate has been cut by over half since the implementation of the Affordable Care Act. Our state's exchange, Connect for Colorado, has been a huge success with over 150,000 people, including myself, have used it to enroll in a quality health care plan. There are so many stories that I hear from my constituents who are grateful for the Affordable Care Act. People like Robin in Eagle County, who could barely afford her $600 a month health care premium before the Affordable Care Act, but now, thanks to the Affordable Care Act, pays just $132 a month. Or couples like Mike and Lynn in Loveland, whose health care costs more than their mortgage before the Affordable Care Act, $850 per month, but now found a plan that costs just $200 a month in the exchange. For real people in my district like Robin, Mike, and Lynn, the Affordable Care Act provides real, tangible benefits, lowers costs, and increases access to critical care they need in order to live healthy lives. I spoke with another man in my district who didn't go to a doctor for a year when he was uninsured. After the Affordable Care Act, he was eligible for Medicaid for the first time, and when he received a colonoscopy, doctors discovered and removed precancerous polyps. Without the Affordable Care Act Medicaid expansion, who knows how long he would have waited to see a doctor or whether he would even be alive today. The Affordable Care Act has brought down costs and spread the responsibility among everybody, both consumers and employees and employers, and healthcare spending has been growing at the slowest rate in over 50 years, according to the CMS. As a businessman myself who understands the difficulty of navigating our nation's employer healthcare system, I know the Affordable Care Act is working to protect our companies and encourage the next great generation of entrepreneurs. The Affordable Care Act is a major piece of legislation, and like any major piece of legislation, of course it's far from perfect. And I'm more than happy to work with my colleagues in a bipartisan basis to constructively address problems in the Affordable Care Act and to make improvements. But this 61st effort at repeal is hardly a constructed effort to make the Affordable Care Act work better for American families. This markup would increase the deficit. It's a thinly veiled, politically motivated attack on the Affordable Care Act to try to use the budget reconciliation process to repeal it. I'm interested to hear how people on both sides of the aisle can move beyond the rhetoric and work together to improve the Affordable Care Act to help make sure it works even better for American businesses, for the American people, to create good-paying jobs, to constrain costs, and to save lives. And today's effort is yet another example of how not to do that. I yield back the balance of my time.
Gentleman yields back. Dr. Rowe, you recognize for 5 minutes.
I thank the gentleman, the chairman, for recognizing me. And I know the ranking member, Mr. Scott, mentioned in his opening statement about the premiums from a 2013 article in the New York Times about how the premiums had dropped. And if you'll just check the Kaiser Family Foundation, which I just did, the average premiums around the country in the individual market are $235 a month, and they're $428 a month in New York. They're still almost twice what they are in other states. Look, the premise of increasing access and reducing cost, everybody in this room agrees with. I certainly do as a physician. I worked for decades trying to do just that. So what happened, we did increase access by expanding Medicaid. There's no question that's true. Many people like myself lost my insurance when, and I had to go on the DC exchange to buy mine, which was much more expensive, which I can afford, but many people cannot. And what's happened in the insurance market out there to make it, quotes, affordable, And this is happening in the real world today. I just talked to our hospital people at home, which is a billion-dollar system. If you go in for preventive services to come to see me, and I find something wrong with you, that part of your coverage is paid for. But then you have an out-of-pocket that may be $2,500, $3,000, $5,000, $6,000 for a family. Look where I live in rural Appalachia. If you make $30,000 or $35,000 a year, which many families do, it's unaffordable. And what we're seeing happen there is that care is not being provided. If I find something on a patient of mine and she needs it, let's say she needs an ultrasound, that's on her dime, up to $5,000 or $6,000 or $3,000, whatever out of pocket is. In our hospital system at home now, 60% of the uncollectible debt are people with insurance. Let me repeat that. 60% of the uncollectible debt are people with health insurance coverage because they can't pay that. I just went through a very extensive illness with my family this year, and I had the money because I had a health savings account, and I was able, because of my position, to have the resources to pay. But I thought about how many patients couldn't do that. And I've had my physician friends at home tell me that people are delaying care because of this. So it's not as glowing a report as you might think. And certainly it's better when more people have coverage. And just to show you the affordable part, the private sector part's working pretty well at trying to hold costs down using prevention, which we all agree with. But in our state of Tennessee, Blue Cross and Blue Shield, the last 2 years lost $250 million on the Affordable Care Act. They're asking for a 36% increase. I think the premiums will be out this year. Minnesota and New Mexico are looking at 50% increases. Oregon, 25% increases. Now, I don't know where the money's going when you hear about how the rates are, the rate of increased spending is going down, but somebody's keeping the money. When you have these premiums going up at that rate, I don't know whether the insurance companies are making more profit. They tell me in Tennessee, the Blue Cross Blue Shield people tell me they are not, but I guess that's for another debate. But I think this particular amendment right here, or in the reconciliation package, actually makes it better. You ask us to help improve it. I think this does just that. I think it takes one more onerous obligation that a business has out there to try to figure out if people have two different insurance policies. I think it makes it. I think Ms. Stefanik's amendment is a good one, and I would strongly encourage our colleagues across the aisle to support this, and I think we are working to try to improve this bill with this amendment. With that, I yield back, Mr. Chairman.
Gentleman yields back. Other members? Ms. Wilson, you're recognized for 5 minutes.
Thank you, Mr. Chairman, and thank you, Ranking Member Scott. For decades, the American health system failed to adhere to one of our deepest held American values. As the Pope reminded us last week, we must care for others. It was a travesty that any American could be forced into financial ruin just because they had the misfortune of becoming sick in America. It was a shame that any American could delay getting the treatment they need because they could not afford to do so. It was a disgrace that wealth and power were a determinant of health and well-being. The ACA was based on the principle that we must care for others. ACA has taken us closer to providing for our most vulnerable and those with the most humble means, the very individuals that the Pope reminded us are in a special need of our care. Think of the low-income mothers caring for small children. Think of young people starting out. These people who we represent wrestle with the very real possibility that one trip to the hospital could send them into a spiral of debt that would take months or years to pay off. But now that Obamacare is here and has been cemented in the law of the land, millions more Americans not only have the health coverage they deserve, but the added peace of mind that comes with knowing they won't be destroyed financially or forced into bankruptcy, homelessness, or hunger just because they happen to have the misfortune of becoming ill in America. This year, Florida led the nation in marketplace enrollees, with more than 1.5 million Floridians getting the coverage they need. My district, Florida District 24, has the third highest number of people in the nation who benefit from subsidies provided under Obamacare. This means more Floridians than ever are now receiving affordable, quality health care through the federal exchange. Let me share this with you about a young lady in Miami, Florida, Julie Mansfield. Julie Mansfield was diagnosed with uterine fibroids, a painful non-cancerous growth in 2009. Shortly after diagnosis, the former director of cultural arts at the city of Miami was laid off. Unable to afford COBRA coverage, Ms. Mansfield went without proper care for more than 4 years while struggling with the debilitating fibroids. Walking upright was impossible. Getting out of bed was impossible, Ms. Mansfield said. In 2013, Ms. Mansfield signed up for coverage in the first wave of ACA enrollment, choosing a $265 a month Florida Blue plan with a subsidy of $232. 4 months later, she had a long-awaited partial hysterectomy, and the pain went away. The surgery cost her about $1,000. Ms. Mansfield, who now does freelance consulting, has to have more surgery to remove scar tissue. Without the subsidies, she wouldn't be able to afford it. When the Pope talked about caring for the less fortunate, remember that such actions are not hypothetical. As the Pope stated, legislative activity is always based on the care for the people. He reminded us that we were invited, called, and convened to care for others by those who elected us. Our duty to care is manifested in our public policy choices. A vote for reconciliation is a vote to increase the number of uninsured. It is a vote to leave more Americans vulnerable and a clear rejection of our calling to care for the people. So I urge all of my colleagues to not support this proposal. I yield back the remainder of my time.
Gentlelady yields back. Other members seeking recognition. Mr. Hinojosa, you're recognized for 5 minutes.
Thank you, Chairman Klein and Ranking Member Scott. I stand in strong opposition to this reconciliation bill. The majority has attempted more than 60 efforts to repeal the Affordable Care Act without any meaningful proposal to replace it. You have yet to show the American people what your proposed bill would do for them, or show us on the committee how we could afford a quality health care program under your party. In simple terms, a vote for reconciliation would cancel health insurance from approximately 10 million Americans who are already benefiting from the Affordable Care Act. Millions more who have enrolled in expanded Medicaid programs, and even millions of seniors who have already saved money because of ACA. While my state of Texas still has the highest rate of uninsured people, that percentage has declined from 22% to 19%. In my congressional district, because of the Affordable Care Act, there are over 100,000 individuals who now have health insurance, including 27,000 children and over 88,000 seniors who are now eligible for Medicare preventive services without paying any co-pays, co-insurance, nor deductibles. Today, under the ACA, no child, family, or senior citizen is denied medical care. And yet, these are the protections that this majority wants to take away from them. In the same week that this majority would repeal the ACA without offering a serious proposal to provide solutions to the uninsured and the underinsured, the majority party would also deprive women of critical health services by canceling the funding for Planned Parenthood. Today, 1 in 5 women go to Planned Parenthood for health services. It seems to me the majority Republicans are obsessed with weakening women's health programs at a time when we have many other pressing issues. In closing, I want to say that this reconciliation bill is not about controlling federal spending. Rather, it's about the majority wanting to attack the programs that are working for millions of Americans and perpetuating the ongoing assault on poor and working middle-class Americans. I strongly urge my colleagues to vote no. I yield back.
Gentleman yields back. Other members seeking Ms. Davis, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I guess the one good thing I could say is that we're seeing the majority focusing on health care. That's a good thing. We like to do that. It's important. And I think the references to Pope Francis's visit and many of the things that he said, I think resonated with everybody. I happen to not be Catholic, but I certainly enjoyed and listened heartily to what he had to say. You know, it's disappointing to see a number of issues that could have been addressed in a bipartisan fashion drawn into another partisan attempt to go after a law that has helped over 17 million Americans get insurance. All the things that my colleagues said earlier about premiums rising and some of the problems we've seen, those had escalated before the Affordable Care Act. Those were the issues, those were the stories that we heard every single day of people who found themselves, even if they thought they had insurance, that their coverage was not sufficient. I remember being quite surprised to learn that women had health insurance policies but did not cover their pregnancy, didn't cover any prenatal visits. How can you sell something to a young woman and not cover those services? That's where we were. The other place we were is that about 30% of the healthcare dollar was going to companies. It wasn't going to the people who needed the support, who needed the healthcare, who needed the tests. It was going to companies. And we were able to redo that, you know, to reconfigure how that moves forward. I'll be perfectly honest, just like many other members, we have people who have come to us who have problems with the Affordable Care Act, and we do everything we can to make sure that it works for them. But it is far under what we saw before. So we need to be really honest and upright about, you know, where are the problems? They're out there, but they pale in comparison to what we were looking at in the past. The other thing that I think we really just need to recognize and understand is, you know, we're dealing with this issue in this way because of attacks and baseless allegations against Planned Parenthood. This is an organization that provides vital health services for women and families around the country. I can't go anywhere in my district without young women, particularly, and not all young, but sort of in their earlier experiences of raising families and looking to a future, who talk about what Planned Parenthood has meant to me and meant to them. You know, the very, very small percentage of what Planned Parenthood does is what's being attacked today. It's such a tiny percentage, and the reality is that federal spending on those services is already tightly restricted. Tightly restricted. So anybody can go in and check what that is. Instead, the funding that's being targeted actually goes to cancer screenings. Cancer screenings. Do we really want to cut out those opportunities for women to get that kind of support? STI treatment, prenatal care, again, infertility testing, non-controversial services a Planned Parenthood provides for millions of Americans. I don't think we can afford to cut support for these programs any more than we can afford to repeal the Affordable Care Act. That is not what my constituents are asking me to do. I'm not sure that there's a run on that request from throughout the country. People value the fact that they have that ability today. They know they're not likely to be bankrupt like there was a greater possibility in the past. It's making a difference for them throughout the country. I yield back.
Gentlelady yields back. Mr. Thompson, you're recognized for 5 minutes.
Chairman, thank you. I've been taking pause to think, wonder whether I was in right hearing. You know, we're talking about Planned Parenthood. I'm not sure that, I don't think that's what we're talking about, the underlying legislation that we're looking at. That seems to be some confusions on the part of some of my colleagues. Although I will say, I'm thankful, I mean, I represent 24% of the land mass of Pennsylvania. I'm thankful I do not have any Planned Parenthood clinics in my district because of the reputation of what they do. But I'm so thankful as a former healthcare professional that I'm blessed with federally qualified health centers, with nonprofit clinics, with faith-based organizations that are providing high quality, compassionate care for every woman every man and respecting every unborn child. With that said, I mean, we're talking about something today that is a discrete change. And I get the sense that, I heard the word cemented used, like somehow the Affordable Care Act is in cement. It was perfect. It's never going to change. Well, here's a sense of reality, folks. That law has been changed at a minimum 49 times. 17 of those times came with Democratic support and a Democrat-led Senate and a Democratic president that passed that. There's an acknowledgement it was flawed. And no piece of legislation is perfect. I get that part. I think that our responsibility, and I hope you would agree, our authority and our responsibility is to improve and refine, that we should always be looking at what the law of the land is that have passed by whatever measure or force or motivation or inspiration, but we should always be looking to refine and improve. And this is just continuing that spirit 49 times. And I would say 32 of those times were changes that I think were some probably pretty good changes, though I disagree with the mechanism, were done by the administration. 32 times this law has been changed at a minimum by this administration. And at least 17 times, there's more than that, I know, of laws that we've actually have passed, provisions within law that have gone the distance where the president signed. So today, we're just continuing that process, which I think is what we're charged with, is to, on behalf of the American people, to improve and refine where we can. And this is just a small, discrete measure today. It is not, it sounds like the world's going to come to the end based on the comments of some of my colleagues. I would just encourage support of the gentlelady's from New York's motion and on the underlying bill as well. And Mr. Chairman, I yield back.
Gentleman yields back. Other members seeking recognition. Ms. Bonamici, you're recognized for 5 minutes.
Well, thank you very much, Mr. Chairman. I move to strike the last word. Since the Affordable Care Act took effect, more than 17 million uninsured Americans have been able to get high-quality, affordable health coverage. In my home state, in Oregon, the uninsured rate has dropped considerably since the ACA was implemented. And of course, the ACA does more than help the uninsured gain coverage. It has also helped control health care costs and put in place important consumer protections. Because of the ACA, Americans can get health coverage without worrying about whether they have a pre-existing condition or whether they will be charged more for being a woman. Millions of Americans are able to enjoy free preventive services, and Americans are able to seek treatment for illnesses like hemophilia and multiple sclerosis without the fear of exceeding annual and lifetime limits on benefits. The Affordable Care Act has been successful for seniors. Millions of seniors nationwide are paying less for prescription drugs. In Oregon, Medicare beneficiaries saved an average of $807 in 2014. These are cost savings that make a real difference in people's lives. Young adults have seen a benefit under the health care law. Millions of young adults have been able to stay longer on their parents' plans, and others are now able to afford comprehensive coverage. And the Affordable Care Act has helped women. According to the Department of Health and Human Services, the law has extended coverage for maternity services to more than 8 million women. More women, including more than 300,000 women in Oregon, are also able to access affordable preventive services like mammograms and well women visits. We should be doing all we can to advance women's health, and today, in fact, I've introduced a bill to expand access to reproductive health care for all women, the 21st Century Women's Health Act, which Senator Patty Murray introduced this year in the Senate. It will help deliver a full range of reproductive services, including contraceptive care, and address important workforce needs. I cannot help but notice the disparity between efforts to increase access to comprehensive health care for women and efforts including this markup today, that are part of a broader strategy to undermine the Affordable Care Act, which would jeopardize access to affordable health care services for millions. We should not ignore the tremendous benefits of the ACA, the benefits enjoyed by seniors, young adults, women, families struggling to make ends meet, individuals who require costly treatments, and people with pre-existing conditions like diabetes and cancer. Of course, we have opportunities to make the law work better for employers, for providers, for insurers, and individual Americans. Unfortunately, instead of having a productive conversation about ways to improve the ACA, Congress is using the budget reconciliation process to force through changes that would make it more expensive and more difficult for many Americans to receive high-quality care. I look forward to a productive discussion about how we can make the law work better. Unfortunately, I'm disappointed in the process in the House this week, and I urge my colleagues to vote no on the recommendations before the committee. Thank you, Mr. Chairman. I yield back the balance of my time.
Gentlelady yields back. Are there other members seeking recognition? Mr. Pocan, you recognize. 5 minutes.
Oh, thank you, Mr. Chairman. I move to strike the last word. I have a dog back home that has this green fuzzy toy with a squeaker in it. And no matter how many times I throw it, he brings it back. And it's ragged, it's been chewed up, but I think I've sat there for a long time, and if I throw it, it comes back. But I don't even know if he would do it 61 times. And that's a bit how I feel about what we're doing and the majority party does with the Affordable Care Act. You know, I can just tell you from my business, I've had a business for 28 years. For my employees, I pay 100% of their health care costs. And in the last few years, I have seen the lowest increases I've ever seen. I used to always see double digit, not just like 10, 11%, but like 30 and 40% increases in health insurance costs. And I can just tell you the practical effect, what it's been to me as an employer, is I've saved money on my health insurance so that I've got more money for my business. But I would really love to know from someone on the other side of the aisle during their time that they have coming up, which of these points about the Affordable Care Act is the most egregious that makes them bring it back to us that 61st time, no matter how ragged, no matter how much you're not going to replace it. What of these points is the one that's the most egregious as you look at it? Is it the fact that the uninsured rate has dropped by 35% since October of 2013? Or the fact that 17.6 million uninsured Americans have gained health insurance because of the Affordable Care Act? Or maybe it's because 129 million Americans with pre-existing conditions no longer have to worry about being denied their coverage or charged higher premiums due to their health status. Or maybe the 105 million Americans who no longer have a lifetime limit or annual limit on their coverage. Maybe that's the point that gets you the most. Maybe it's the 9.4 million seniors who've saved more than $15 billion on their prescription drugs. Or the 39 million seniors in Medicare who've received free preventive services with no copay under the Affordable Care Act. Or maybe it's since the enactment of the Affordable Care Act, the solvency of the Medicare Trust Fund has been extended by 13 years. Or maybe a different direction. Americans have saved $9 billion since 2011 because of the requirement that insurers have to spend at least 80% of every premium dollar they receive on quality health care. Or the fact that 85% of consumers buying health care plans in the marketplace are receiving tax credits to make their plans affordable. Or that 76 million Americans in private plans have received new or expanded access to free preventive services with absolutely no copay. Or maybe the fact that over the last few years, healthcare spending has been growing at the slowest rate in over 50 years. I mean, there are many benefits that we have seen out of the Affordable Care Act, and I just can't understand why the majority party has this puppy-like obsession with bringing this bill back to us over and over without any solution. And I think the bottom line that we should all remember is in 2014, the Commonwealth Fund did a survey. 78% of newly insured consumers in the marketplace, including 74% of Republicans, expressed satisfaction with their coverage. People in America are having a very different debate than we have inside the Beltway here. They're happy with the access they've gotten, all these benefits we've gotten, and I think this budget reconciliation is just another 61st attempt to bring us this ragged bill back one more time without an alternative, and I would hope that we would not support this, and I would hope at some point we can get a budget done, not for a kick at the can for a few months at a time, but actually do the process the way we should. And I yield back my time, Mr. Chairman.
Gentleman yields back. Are there other members seeking recognition? Mr. Russell, you're recognized for 5 minutes.
Thank you, Mr. Chairman. This measure before us is not about hating the poor or hating women. The measure is not about hating chocolate or hating puppies. It is about hating waste. We hear rhetoric about how everyone would be happy to sit down and work out provisions where there are things that need to be worked out. Former Speaker of the House, Nancy Pelosi, said that the Affordable Care Act needs to be passed so that we know what's in it. Well, now that we do know what's in it, what this measure, which I applaud my colleague, Ms. Stefanik, what this is about is repealing Section 1511. And if you would care to listen, it is not about repealing the Affordable Care Act. It is about repealing a section, 1511, which, by the way, has not even been implemented yet. So all of the prophecy of doom and gloom has not even taken place yet with the repeal because this has not been implemented yet. However, no one wanting or needing enrollment is denied under this measure should it pass. In fact, everyone that you mention can absolutely enroll in the program without prohibition. But what it does do, Mr. Chairman, is that those not needing enrollment would not be enforced to enroll. And who are we talking about? Well, those other people that apparently, Mr. Chairman, our Republicans hate, like veterans. If 1511 were to be implemented, people like me would be forced to take health care I don't need. I have TRICARE. I don't need the Affordable Care Act for my health insurance. My provision's under Title 10, and I take that by right of having served my country and fought in a few wars. Nevertheless, we don't need to make those recommendations. We don't need to make those corrections because it's all about some fetching a ball or 61 times or something of that nature, Mr. Chairman. But when in reality, it is not forcing veterans to take a health care that they do not need, and it's not forcing employers to try to go through the morass of what that conflict would do. It eliminates duplicative waste. I have 5 children. 4 of them are under the age of 26. If they were to go and be employed, well, some of them, by right of my own TRICARE, are eligible for health care. An employer under 1511 would be forced to enroll them in a health insurance that they do not need. That's what we're talking about here. We're not talking about repeal of the act. We're not talking about any of these things. What we are talking about is repeal of a section that hasn't even been implemented yet, nor should it be, because it doesn't need to happen. We have the National Restaurant Association and the Retail Industry Leaders Association that also support this measure. And I might remind my colleagues on the other side of the aisle, Mr. Chairman, that these groups employ an awful lot of the young and underserved that we talk about, and yet they see the need of this so that they can encourage people that need the health insurance under these plans to do it, but those that don't, they won't be forced to take something that is not required. It eliminates duplicative waste. Now we, in our passions and our emotions and our concerns, we all care about the same things. We all have an awful lot of overlapping concerns. And we can get out on the periphery and we can talk about all of the things and beat each other over the head on issues that are not being discussed here this morning. But that's not what this is about. This is about a section, 1511, that would be eliminated, that's not even been implemented, so that we can prohibit duplicative waste. And I would think that that ought to be something that we could all find overlapping circles with. And thank you, Mr. Chairman. I yield back my time.
Gentleman yields back. Mr. Takano, you're recognized for 5 minutes.
Oh, I'm heartened to hear members of the majority speak in vocabulary that says refine and improve. Would that were really the case, because prior to today's markup, what I had heard for the past couple of years, the first term I was in Congress, was repeal and replace. Of course, really, there was no replacing the ACA with anything better. What really was the objective of the majority was to undermine and destroy. Mr. Chairman, I am disappointed that this committee is wasting time yet again on this futile effort to undermine and destroy the Affordable Care Act. This legislation before us today, along with the provisions being considered by the Energy and Commerce Committee and the Ways and Means Committee, will gut the ACA and deny millions access to care and move the nation backward. It is not just about what is before this committee. It is what is before this committee combined with what is before the other two committees that's going to be submitted to the Budget Committee for reconciliation. Make no mistake, this is about undermining and destroying the ACA. It has been 5 years since the Affordable Care Act passed, and in those last 5 years, there have been real progress for my constituents and Americans across the country. When I took office in 2013, a quarter of my constituents were uninsured. Between 2012 and 2014, the uninsured rate in my district dropped more than 6%, and more than 40,000 people are newly insured. Those numbers don't even take into account my constituents who got coverage during the second year of open enrollment. Statewide, more than 4 million Californians who could not get coverage have health insurance through the state marketplace or Medicaid. The vast majority of these received credits to help them afford the coverage. Now, thanks to the ACA, my constituents and many others can sleep better at night. Folks like Heather Froley, the older sister of one of my childhood friends. Heather had a pre-existing condition, and for years before the ACA, she was priced out of the insurance market and denied coverage. She contacted me during the first enrollment period in 2014 to let me know that she had successfully purchased a plan and was thrilled to be covered for the first time in many years. Soon after, Heather was diagnosed with stage 2 breast cancer. In the following months, she underwent treatment, and I'm happy to report Heather is now cancer-free. Heather unabashedly credits the Affordable Care Act with saving her life. And had she not been able to obtain coverage, she would have not gone to that appointment where doctors first discovered her cancer. She was fortunate to catch the cancer before it progressed further. I don't even want to think about what would have been done, what would have happened to Heather without the Affordable Care Act. We have made too much progress to turn back, and yet the Republican majority remains obsessed with repealing the Affordable Care Act. We are taking valuable time in 3 committees this week focusing on a futile attempt to repeal a law that has withstood 2 Supreme Court cases. Instead, we could be focusing on the vast number of issues within the committee's jurisdiction to help working families. When this package comes to the House floor, it will mark the 61st time my colleagues have attempted to repeal or gut the ACA. We cannot go back to the days when people could get kicked off their plans as soon as they got sick, or find out too late that they exceeded their plan's annual limit when they needed it the most. We can't go back to the days when folks like Heather Froley put off care because they couldn't afford the cost. I urge my colleagues to stop this farce and oppose this bill, and I yield back my time.
Gentleman yields back. Ms. Clark, were you seeking? You're recognized for 5 minutes.
Thank you, Mr. Chairman and Ranking Member Scott. I, too, like the gentleman from California, have been heartened by some of the words that I've heard from my colleagues. Let's develop a patient-centered healthcare system. Let's increase access for American people. Let's focus on prevention, reducing costs, increase efficiency. But what we have here today is not just a discrete measure, but part of a reconciliation package that will gut the Affordable Care Act. The words simply don't match the actions. And for the 61st time, we're going to look to repeal a law that insures 105 million people who no longer have a lifetime coverage limit. For the 61st time, we'll look to repeal a law that protects the 129 million people in this country with pre-existing conditions. And this action is a 1-2 punch to American women, to the 2.7 million women who seek health care at Planned Parenthood. Whatever your feelings on abortion are, how does it help build a strong, robust, accessible health care system when we are looking at denying 390,000 women access to cancer screenings, to wellness visits? This simply does not make sense, and it is destructive politics at work again. I'm going to go out on a limb and say that this attempt to repeal the Affordable Care Act will not ultimately be successful. And I hope that when we finish this redundant, pointless exercise, we can go back to doing the work of the American people and of this committee. I yield back.
Gentlelady yields back. Mr. Courtney, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, I was sort of struck listening to some of the comments here today about the fact that actually just on Monday, one of our colleagues, Mr. Guthrie, was successful getting H.R. 1624, the Protecting Affordable Coverage for Employees Act, passed unanimously in the House. It amended the Affordable Care Act to give states the options to redefine a small employer from 50 up to 100. We also, on Monday, passed the Equitable Access to Care Health Act, which expanded the conscientious exemption for Christian Scientists. Again, totally by unanimous consent on Monday's calendar. So the fact of the matter is that there is ways that we can surgically modify this law. I proudly voted for it, defended it in 3 elections since 2010, but I'm the first to say that it was not the 10 commandments that we passed. There is always opportunities to understand problems in the law and make changes, and we did it with the 1099 filing requirement for small businesses a couple years ago, which struck that from the law. We struck the Class Act, which was a well-intentioned provision for long-term care payroll deduction, but was just not financially sustainable. And we also extended TRICARE coverage for military families to age 26, which was left out when the bill originally passed. So the fact of the matter is that Congress has acted, but we've done it in a surgical fashion. We haven't done it as part of a steaming large reconciliation bill, which is full of poison pills, almost a poison tree, and which, again, the chairman in his opening remarks was pretty clear about the fact that, what that reconciliation package is trying to do is basically undermine the Affordable Care Act. I come from Connecticut, a state that embraced the law. We have a high-functioning exchange. We are totally off the federal grid right now. It is completely self-sustaining. The uninsured rate dropped from 8% down to 4%. We have more insurers in our market today than we did in 2010. I was at a Labor Day picnic a few weeks ago with one of the largest private employers in Windham, Connecticut, Willimantic Waste. The HR guy was swimming in the pool with his kid, and again, he was very worried about the part-time, full-time definition a couple of years ago, which, as you know, came before this committee. His rates have gone down the last 2 years for his business, which is about 270 employees. And he yelled to me from the pool, "Tell President Obama thank you for the Affordable Care Act," because his rates have gone down. There's more competition in the Connecticut insurance off the exchange than there was in 2010. So the fact of the matter is that there is tremendous evidence that the law is achieving the goals of affordable coverage and helping businesses with more options. The gentlelady's amendment that's before us today may have some very good arguments that we should be thinking about and considering. Again, we have time, since the Labor Department has clearly signaled that they have no intention to even put it on their regulatory agenda. But the fact of the matter is that it should not be part of a package which undermines the structure of a new marketplace. And again, the exchange, which testified yesterday at the Energy and Commerce Committee, and Fortune magazine has described the Connecticut Exchange as the absolute in a class of its own, kind of like the UConn women's basketball team. the fact of the matter is they've analyzed what the Ways and Means Committee's provisions would do, and it would actually totally capsize the market and drive rates up if the individual mandate was repealed, which is clearly, you know, one of the major poison pills that is going to prevent it from becoming enacted. We are going through an exercise in futility. Everybody knows the president's going to veto it. The veto will be sustained. We're about 12 hours from the government shutting down. You know, again, let's focus on what we can accomplish. And again, Mr. Guthrie and Representative Davis this week showed us the way. They showed us the path forward about how you make smart changes to the law when you do it surgically and you do it on a bipartisan basis. And hopefully, after we get through this reconciliation exercise, we as a committee can be part of that leadership process in terms of improving the Affordable Care Act. And with that, I yield back.
The gentleman yields back. Mr. Scott, you are recognized for 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, a few minutes ago, I submitted for the record the New York Times article that described how the ACA reduced premiums in New York for individuals buying insurance in New York State. The headline in that article was, "Health Plan Cost for New Yorkers Set to Fall 50%. The article describes how many people who were then spending $1,000 a month for insurance would be able to get that insurance for under $400, and many will pay a lot less than that when you consider the tax credits. This reconciliation package of bills will repeal the provisions that cause that reduction." Mr. Chairman, my opening statement outlined the concerns that I had with this process and the bill before the committee today. I would further remind the members of the committee that while we consider this bill, two other committees, the Energy and Commerce Committee and Ways and Means Committee, have passed or are about to pass legislation this week that will be packaged together to make the full reconciliation package. Legislation considered by those committees will make drastic cuts to the Prevention Fund, cut funding for Planned Parenthood, and erode the employer and individual responsibility provisions in the Affordable Care Act, among other harmful provisions. I cannot support the legislation being considered today due to its inevitable inclusion in that reconciliation package that will take health coverage away from hardworking American families. When we passed the Affordable Care Act, we did so in a fiscally responsible way. The law not only was paid for, but it also helped reduce the budget deficit. Now we see the committee going in and picking and choosing provisions and taxes to get rid of without taking into consideration the impact on consumers or the long-term impact on the budget. The Ways and Means Committee voted yesterday to repeal the employer and individual mandate provisions, which translates to fewer Americans having health insurance and those who have insurance paying more for it. That will cost Americans both in terms of real dollars and their health and well-being. Mr. Chairman, we have to be reminded that this is not a deficit reduction exercise. In fact, we need to remember that the Budget Conference Committee agreement that creates the reconciliation process states that each reporting committee should also determine the most effective methods by which the ACA can be repealed in its entirety. So we are here today not to address the budget challenges, but to attack the Affordable Care Act. Mr. Chairman, committee Democrats are open to improving the Affordable Care Act and building upon the progress we've made, but this bill is just another attempt to undo the progress. Finally, Mr. Chairman, as members have indicated, the provision eliminated in this bill haven't even been implemented, and when they are implemented, the problems that have been described can easily be resolved in regulations. But the cost savings assumed in the bill are a result of many people who potentially need insurance not getting that insurance. So I urge my colleagues to vote against the legislation and yield back the balance of my time.
Gentleman yields back. I thank the gentleman. Chair will recognize himself for a minute or so here. We are dealing here today, we're talking about whether or not we're saving money. We're charged in that joint budget resolution under Section 2002. It says the Committee on Education and Workforce of the House of Representatives shall submit changes in laws within its jurisdiction to reduce the deficit by not less than $1 billion for the period of fiscal years 2016 through 2025. That is what we're doing here today. The reducing the deficit by not less than $1 billion. The score here is that we're reducing the deficit by some $8 billion, so we are in compliance with what we are directed to do. I understand there are no additional amendments, so the question now occurs on the amendment in the nature of a substitute. All those in favor say aye. Aye. All those opposed say no.
No.
The ayes have it, and the amendment is agreed to. If there are no other members wishing to speak, I will now entertain a motion to transmit the committee report as amended and recognize Dr. Rowe.
Thank you, Mr. Chairman. I move that the Committee on Education and the Workforce authorize the chairman to transmit the recommendations of this committee as in the amended committee print and all appropriate accompanying material, including additional supplemental or dissenting views, to the House Committee on the Budget in order to comply with the reconciliation directive included in Section 202A of the concurrent resolution on the budget for fiscal year 2016, Senate Current Resolution 11, and consistent with Section 310 of the Congressional Budget and Impound Control Act of 1974.
The question is on favorably transmitting the committee print as amended. All those in favor signify by saying aye.
Aye.
Those opposed signify by saying no.
No.
The ayes appear to have it. Recorded vote is requested. I think she's ready. Clerk will call the roll.
Mr. Klein?
Aye.
Mr. Klein votes aye. Mr. Wilson?
Aye.
Mr. Wilson votes aye. Mrs. Fox?
Aye.
Mrs. Fox votes aye. Mr. Hunter? Mr. Hunter votes aye. Mr. Rowe? Mr. Rowe votes aye. Mr. Thompson? Mr. Thompson votes aye. Mr. Wahlberg? Mr. Wahlberg votes aye. Mr. Salmon? Mr. Guthrie? Mr. Rokita? Mr. Rokita votes aye. Mr. Barletta? Mr. Barletta votes aye. Mr. Heck? Mr. Heck votes aye. Mr. Messer? Mr. Byrne? Mr. Byrne votes aye. Mr. Bratt? Mr. Bratt votes aye. Mr. Carter? Mr. Carter votes aye. Mr. Bishop? Mr. Bishop votes aye. Mr. Grothman? Mr. Grothman votes aye. Mr. Russell? Mr. Russell votes aye. Mr. Corbello? Ms. Stefanik? Ms. Stefanik votes aye. Mr. Allen? Mr. Allen votes aye. Mr. Scott?
No.
Mr. Scott votes no. Mr. Hinojosa? Mr. Hinojosa votes no. Mrs. Davis? Mrs. Davis votes no. Mr. Grijalva? Mr. Grijalva votes no. Mr. Courtney? Mr. Courtney votes no. Ms. Fudge? Ms. Fudge votes no. Mr. Polis? Mr. Polis votes no. Mr. Sablon? Ms. Wilson? Ms. Wilson votes no. Ms. Bonamici? Ms. Bonamici votes no. Mr. Pocan? Mr. Pocan votes no. Mr. Takano?
No.
Mr. Takano votes no. Mr. Jeffries?
No.
Mr. Jeffries votes no. Ms. Clark? No. Ms. Clark votes no. Ms. Adams? No. Ms. Adams votes no. Mr. Desaunier? No. Mr. Desaunier votes no.
We ask the clerk to call the names of those members who have not yet been recorded.
Mr. Salmon? Mr. Guthrie? Yes. Mr. Guthrie votes aye. Mr. Messer? Yes. Mr. Messer votes aye. Mr. Corbello? Yes. Mr. Corbello votes aye. Mr. Sablon?
How is Mr. Salmon recorded?
Mr. Salmon is not recorded. Yes. Mr. Salmon votes aye.
The clerk will report the tally.
Mr. Chairman, on this vote, there are 22 yeas and 15 nays.
The ayes have it, and the motion is agreed to. The committee print as amended is ordered, transmitted to the House Committee on the Budget. The chair notes for the record that a quorum is present. I now recognize Mr. Rowe.
Thank you, Chairman. I ask unanimous consent that the staff be authorized to make necessary and technical changes to the committee print and pursuant to House Rule 11, Clause 2L. I give notice that all members have the requisite number of days to file additional or minority views.
Without objection, so ordered. The committee stands adjourned.